Nigeria has taken a significant step in combating tuberculosis and other infectious diseases with the deployment of 333 Truenat diagnostic devices nationwide. Now, the initiative, spearheaded by the Ministry of Health and supported by the Global Fund, aims to leverage advanced technology to improve testing access in underserved regions. The Truenat system, a portable battery-operated molecular testing device, is designed for point-of-care use and can be paired with solar-powered Trulux charging stations for operations in remote areas. Now, this innovative approach ensures rapid and accurate diagnostic results even in resource-limited settings. A recent study published in Public Health Action showcased the device impact in reducing turnaround times for tuberculosis diagnosis and also increasing case detection rates. This is particularly crucial for Nigeria, which accounts for 75% of the world's missing TB cases and 70% of missing drug-resistant tuberculosis cases. To discuss this, we're joined by CEO of Molbio Diagnostics, Sriram Natarajan. Hello, Sriram. Thank you so much for joining us at this time.
Thank you for calling me. Very happy to be here.
All right, now, can you speak to us, tell us about Molbio's Diagnostic and its mission to combat tuberculosis and other infectious diseases in Nigeria? How does the company's technology differ from traditional testing methods, and what advantages does it offer?
Yeah, see, tuberculosis is a killer disease, and it's the #1 killer of infectious disease worldwide. And globally, if you see, every minute, there are 3 people dying of tuberculosis. So that's the kind of situation. And so the issue has been mainly because the case detection or the diagnosis has not been appropriate, because high-quality diagnostic tools were very, very highly centralized and were not accessible to most of the people. And that's where Molbio came in, and we have designed and innovated a completely decentralized molecular platform where you can actually do a molecular PCR test for tuberculosis, and including drug resistance, right next to the patient. It can be installed anywhere. It's completely independent of a laboratory, can be easily trained. Even small health workers can be trained to do the test. And it can be deployed in very, very, very remote corners, and people can have access to a high-quality diagnostics. So that's the innovation that we have done, and we are already seeing this being implemented globally. And Nigeria, we're happy to say, has also taken the initiative, and we are so happy to be a part of this Nigerian program, so that we can ensure that Nigeria gets Truenat for all the people.
Oh, okay. Now, but how has the adoption of, Truenat technology contributed to scaling up TB testing in Nigeria? If you can actually share specific examples or even success stories that demonstrate the impact of this technology.
Yes, even before this procurement, Nigeria got about 38 Truenat machines through EOSAID, through a program called the INTP. And these 38 machines are in use for the last 3 years in Nigeria, and they are actually placed in very, very remote places, which are not even easily accessible to reach. And all these people are able to do a Truenat test, and they're already seeing a significant increase in case detection. And that's what encouraged the government to go ahead and deploy additional Truenat machines. And this current 333 machines are a part of the scaling up the government is doing. And I believe that as they go along, they will try to see that Truenat machines are available for everybody, everywhere.
All right. Now, but can you explain how Truenat technology utilizes molecular diagnostics, to detect TB and other infectious diseases? How does this approach differ from traditional microbiological methods?
So traditionally, TB testing has been done through what's called a smear microscopy. This is a 150-year-old technology. But the problem with this technology is it's only about 40 to 50% reliable. So half the people who come with TB don't get diagnosed in time, and that's why TB keeps spreading. Then the other technology that's the gold standard technology is culture. But culture is a microbiology test, and it takes almost 15 days to 1 month to get a report, by which time the patients are already lost to the system. So the need of the hour is to have something which is going to be as good as the culture and which can actually give a report within an hour or 2 hours so that the same day the patient is diagnosed and put on treatment. And that's what is the molecular test. In the molecular test, we are actually looking for the DNA specific to tuberculosis and amplifying it multiple times to be able to detect. It's a very sensitive tool. And today this has become the gold standard. And so Truenat uses the same, it's called the PCR, polymerase chain reaction molecular tool. And that's what is the core, technology in Truenat. PCR has been there for a while, but again, it was a centralized model. So that's where we have come in and decentralized it completely. So that's a paradigm change to how molecular testing is now done, even at the primary level.
Well, Sriram, are you saying that, the technology leverages advanced algorithms, and machine learning to enhance test accuracy and speed?
Yes, absolutely. So there is a lot of technology in this now, because first of all, we have miniaturized this entire technology, made it portable, battery operated, as you rightly said earlier, and something which can be done at remote levels. And it also has the capability to transmit data real time to any server. So, for example, if there is a national database that can be populated on a real-time basis, and the government can actually, the program can actually monitor on a real-time what's happening to TB testing all over Nigeria, for example. So that's the level of capability that's built into this system.
Okay. Well, thank you so much, Sriram, for your time and also for speaking to us today.
Thank you very much.